I'm starting it.
Okay.
Yeah. I remember when people come in.
Are we notified?
I think so.
Yeah. Okay. I've never done another on this end of a webinar before.
I just started it because you're supposed to start it a little early.
Yeah, if people are here, we'll get it started.
That's right. We'll start at 7:30. Still got a few minutes, but some keeners might join a little early.
I'd probably be here 5 minutes before. I don't want to miss any of it.
Yeah. Had a good day?
It was good, yeah. Yeah, nice short day at Halifax, which was good. I went to the gym at 5:30 this morning.
Oh, yeah.
That's when my friend and I can go together. She's a teacher. And so when I work the evenings, I'm like, well, I'm up at 7. So we get up and we go.
Yeah.
And
That's
it's
good.
Yeah.
I wish I was a better morning person.
I'm not, but it's
I
just.
really have to get it done then or else it doesn't
Yeah,
happen.
I know. It's hard. It's at the end of the day.
You're like
You just wanna
tired.
go
The
home
older
and
I get
relax.
too, the harder.
It's
I
only
used to
gonna be-
love to work out at night, but it's
I don't
better.
like it. Like if it's after supper, I'm probably not going to go. It's just a reality for me.
Yeah, I guess so. Yeah, especially now. Yeah.
Yep.
Yeah.
A good day.
Yeah, I had a
It
good
was
day
super
too.
nice out, which was good. It's my
Yeah.
roommate's birthday, so I spent some time with him this morning.
That's
We went
great.
on the deck. It was so nice. It was so warm.
It is so nice. It was 17 degrees.
I know, it's crazy. Yeah.
Yeah. Yeah, I need to, I don't know, this time of year, I'm always like, I need to get the summer stuff out, like do the wardrobe change.
But I wouldn't do it yet.
No.
Because April, like it can get cold.
We still sometimes get snow in May.
Yeah,
I don't
exactly.
even want to put that out
Yeah,
there.
but it's possible.
Yeah.
I've had my jacket with me all day, but I haven't been wearing it. I'm like, I'm bringing this because you never know. Like in the second, it could just change and be freezing. So you gotta be ready for it. I'm in full summer mode now after today.
Yeah.
It's like it's summer, we're gonna go swimming and play volleyball, do all these fun summer activities.
Right. Yes, you don't want me on your volleyball team.
Don't quite have the height for it.
No, I enjoy it.
It's fun. Volleyball's a lot of fun.
You know, it's one of those sports that you just have fun.
Yeah.
But yeah, you can't be too serious if I'm on your team.
Exactly. But it's fine. Sometimes it's just fun to go play for fun. I'm like, even though I play volleyball, if I know that I'm just going to play for fun, then it can be fun. Because then you just laugh, right?
Yeah.
You just have a good time with it.
Yeah.
It's
Good skill to have.
Yeah. If it's serious, it's like, okay, you better be good otherwise. So on the bench you go. That's how I am when I coach my kids.
Yeah. So it's 7:30. I just don't know if anyone is on, but we're going to start the webinar. So I feel free to just come along and join in. We wanted to thank you guys for joining us today. Today we are going to be talking about chiropractic care and what you actually do not know about today's chiropractic. So for the webinar, I'm just going to I want you guys to focus on the slides. So I'm going to diminish me and that way you'll just be able to focus on those slides. If I can get them moving here. Okay. So welcome to our webinar, everyone. Thank you for attending. We're excited to be here with you today to share our knowledge with you on what you don't know about today's chiropractic. So who are we? Well, we are, my name is Erin Kempt-Sutherland. I own Choice Health Center, and I own Choice Health Center with my partner who is a physiotherapist, and her name is Saba Chisti. So I am a chiropractor and I've been practicing for over 16 years. I founded Choice Health Center 12 years ago after practicing in some sports medicine clinics in Toronto and Waterloo, Ontario. And I have been enjoying my practice and helping people of all ages ever since. And with me today is Dr. Justin Brooks, Choice Health Center's newest addition to the chiropractic department. And Justin, what got you into chiropractic? Tell us a little bit about yourself.
Sure, Erin. Hey, everyone. I'm Dr. Justin Brooks. So I had my first experience with chiropractic when I was 17 years old, and I had an ankle injury that just wasn't getting better. I was a volleyball player, and I really wanted to get back on the court, and I went to see a chiropractor, and I noticed an immediate difference. And I was able to get back on my feet in no time, and I've been forever grateful to chiropractic since, and I'm so excited I get to help others with other problems in their life as well.
That's awesome. Certainly a lot of former higher level athletes or even recreational athletes get into chiropractic because it is so helpful for athletes.
Yeah, definitely.
Yep. So who is Choice Health Center? Who's the company? What is Choice Health Center? Well, Choice Health Center is Atlantic Canada's largest privately owned multidisciplinary clinic. We offer chiropractic, physiotherapy, including pelvic floor physiotherapy, acupuncture, naturopathic medicine, massage therapy, and concussion management. We also have clinically supervised personal training, kinesiology, a podorthist, and we offer yoga, Pilates, and I'm actually offering the latest class to our studio classes. It's called Kin Stretch. So at Choice Health Center, our goal is your goal. So whether your goal is to be able to keep up with your grandkids or run a marathon, we work with you in a truly collaborative manner, off of one chart together as a team with you to get you there. We want you to thrive, whatever that means to you. We are here to help you thrive. We also feel that education is knowledge, and knowledge is power. So we feel that by reaching out to our community in many ways, including in this way through these educational webinars that we're doing, we're taking massive steps towards helping our community to thrive. So what makes us at Choice Health Center different? So we are actually so different that we have coined a phrase, and it's called the choice difference. This is something that our patients have come to know and trust and expect from us. So even though there's an increasing number of clinics that are incorporating the array of professionals that we provide to our patients at Choice, this is happening, in increasing amounts. However, many of these clinics, while their clinicians may technically be working under the same roof, yes, they are each working within their own practice and within their own individual silos. So there's not a lot of communication between the two silos, and oftentimes you'll get referred maybe on to the next silo or the next department after this practitioner has either exceeded your insurance money or has found that they can't create any more progress for you. Perhaps you've stopped responding to that type of care. So patients will basically experience one silo at a time and are often passed from one silo to the next. But the choice difference is a synergistic approach to care. So what synergy is the belief that the additive effect of two or more inputs is greater than each component would be separately on its own. So 1 + 1 is actually greater than 2. So an example would be like your injuries response to, say, chiropractic. If it's combined at the same time with, let's say, physio in this case, it's greater than if you just did chiropractic or physio alone and separately. So some other notable positive things about Choice Health Center is that we have 2 locations, which are both conveniently located in Dartmouth and Halifax, both with ample free parking, which is kind of nice in these times. And we try and stay ahead of that curve. So we strive to stay ahead of the curve. We offer advanced therapeutic technologies such as laser therapy, which we just had our previous webinar on last month, shockwave therapy, advanced wireless muscle stim, neurofunctional acupuncture, and much more. So today, we're going to get into the meat and potatoes here soon. We have a lot of information to cover, but we so appreciate you being here. We very much respect your time. So we're going to try and keep this webinar to 35 minutes of presentation time. And this will include a live demo of chiropractic treatment. There is a chat button at the bottom. Please type your questions into the chat and we will look for them at the end and answer them. We want to start by explaining to you, first of all, today, what is chiropractic? And then we also want to get into where it came from and where it has evolved to today. We'll touch on the education of today's chiropractic doctor and what to expect on your visits, as well as actually showing you a live demo, as I mentioned. Oh, right, I almost forgot. So participants of this webinar today will receive an amazing offer at the end of the webinar. Hopefully that's not the only reason you'll stick around to hear what we have to say, but if that's what you need, then stay tuned. And here we go. Without further ado, we are going to delve into what you do not know about today's chiropractic.
All right, so I'm going to go over what exactly is chiropractic. So the word chiropractic, it originates from the combination of 2 Greek words, chiro and practicos. So chiropractic literally means to practice or to do with the hands. Chiropractors are primary healthcare professionals, which means we are responsible for all aspects of your health. Even though some aspects are out of our scope, we are responsible for knowing when to refer to other healthcare providers, such as your family medical doctor. Chiropractors are also primary access, which means you do not legally need a referral to see us. Chiropractors have the title doctor because we're all well-trained and able to diagnose. Our scope of practice covers that of the neuromusculoskeletal system, so the nerves, muscles, and bones of the body, and how they interrelate functionally in the body. There's no doubt about it, chiropractic has come a long way from its early days, but chiropractic had a pretty intriguing beginning. Chiropractic was discovered by a guy named D.D. Palmer in the United States in 1895. D.D. was interested in the mechanical function of the spine and nervous system, which led him to adjust a vertebrae, which is a bone in the spine, of a partially deaf janitor, and discovered that a few days later, his hearing was better. This led to the birth of the profession of chiropractic. Nowadays, chiropractic is much more evolved thanks to extensive funding by the US government in the 1990s for chiro research within the National Institute of Health. The research was initially focused on lower back pain and chiropractic care, and chiropractic evolved into being an evidence-based form of care for the entire musculoskeletal system, not just the spine, with the help of accredited educational institutions like the National Institute of Health and the World Health Organization. And by 1992, chiropractic was licensed in every province in Canada, and nowadays the profession overlaps considerably with areas of mainstream medicine, like physiotherapy, sports medicine, and neurology. So you might wonder, how do we get to become chiropractors? So one of my favorite topics to discuss is the education of today's chiropractor, which continues to evolve over the years as technology advances. These photos are taken from our alma mater, the only Anglophone chiropractic college in Canada, CMCC, or the Canadian Memorial Chiropractic College. There is a Francophone college in the Université de Trois-Rivières in Quebec, and you also need at least 3 years of undergraduate education to apply. And chiropractic school is a 4-year program, including a full year of clinical internship. So all in all, a total of at least 7 years. We also have 3 national licensing exams in total. And of course, the education never ends. Chiropractors are required to take additional continuing education courses each year in order to continue their learning, to make sure that we're constantly staying up with research and continually growing our knowledge.
Yeah, and to maintain our licenses as well. Um, Looking at these photos, oh my goodness, it makes me super nostalgic for those good old school days. So long ago for me, not so long ago for you, eh,
Just a little
Justin?
bit, yeah.
We didn't have these high-tech mannequins though back in my day. We just had to learn on each other.
Yeah, I guess that's something new that we had when I was there. So those are actually force sensing tables, and the mannequins go on the force sensing tables. And how that works is it allows us to measure our force output with our hands, and it's just another technological thing that has helped with our learning. So it makes us have a higher level of precision when we are delivering an adjustment.
Just one more way, I guess, that chiropractic has become a little bit more scientific with objective outcome measures.
Definitely.
A little bit more here on the schooling. Yeah, I always love these charts. This one compares it's actually a review. That's it. A review of the curriculum of 18 chiropractic schools, 22 med schools versus 22 med schools worldwide. So I always think the public generally finds them quite interesting. Of course, at CMCC, the hours would differ slightly from these, as these are averages. For example, X-ray radiology at CMCC is 360 hours, which includes learning how to take X-rays, process them, read them, diagnose, and write reports. But yeah, it's kind of neat to look at that and see those differences.
Yeah, and as you can also see, there's a really strong focus on anatomy, and we actually dissect cadavers for 2 full years of school, which allows us to see the nerves, muscles, and bones and joints, what they look like inside the body. And we take courses in diagnosis, in physiology, and neurology, and some courses that aren't even mentioned in the chart, such as embryology, principles of chiropractic, immunology, nutrition, and clinical sciences. So after all of that education and you're going to your chiropractor, what can you expect from your first visit? It's nothing to worry about. The chiropractor will talk with you and take a thorough history consisting of specific questions about the area of complaint, as well as specific questions about your overall health. After the history, we will do a focused physical exam of your primary complaint. This can include things like a postural screen, orthopedic tests, movement testing, muscle testing, a neurological exam, and checking the motion and/or tenderness of your muscles and joints. After that, we will relay the diagnosis to you, what it means, go over our treatment recommendations, any risks, benefits, and alternatives to the treatment. And then once you give consent to the treatment and we deem it safe to proceed, Chiropractors at Choice will treat you on the first visit so we can have you feeling better as soon as possible. Today's chiropractors are so much more than professional back crackers. First of all, we actually treat more than just backs. And second of all, we have so many more tools in our toolbox than the spinal adjustment for helping people. If there's a joint in the body that's not moving properly in the spine, but also in the extremities in places such as your wrists, your ankles, your knees, even your jaw, joint manipulation, which is when we use our hands to place a distinct, quick yet light directional force to the joint, is an option. Another option would be joint mobilization, which is a more gentle, slower maneuver with our hands. Or we may opt to use a handheld instrument, as you can see here, called the activator. Our decisions are based on the information we discovered during your assessment and also your wishes and desires, since it is your body. We also treat the muscular system. We use our hands sometimes for this, as in the active release technique, but again, sometimes we use assistive instruments like the Graston tool that you can see there.
So a leading area of pain management is neurofunctional acupuncture. And every chiropractor that is working at Choice has this additional training outside core chiropractic curriculum for this very reason. It's highly effective. Choice chiropractors also use those cutting edge technologies that I mentioned earlier, such as shockwave therapy and laser therapy. And again, if you have an interest in learning more about laser therapy, you can see the webinar that we did on that on our website as well. And yeah, there's lots of information in general on all of these treatments on our website.
And don't forget, Dr. Erin, no modern chiropractic treatment is complete without providing you with lots of education and guidance in ways that you can self-manage your condition at home.
Exactly. Thank you, Justin.
You're welcome. So our vast array of tools and education allows us to treat the entire body, anything pertaining to the nerves, muscles, or joints of your body, that is just as depicted here in this diagram. So you can see a lot of different conditions that chiropractors can treat. And if you know anyone who has been suffering with any of these conditions or any other areas of complaints, be sure to mention chiropractic to them. There's no need to suffer, and we're here to help.
Awesome. Absolutely. So hang on. I don't know what I did, but I'm going to just go like that. All right. So we've told you a lot about chiropractic, but there are the top 3 best kept secrets about chiropractic that we are going to share with you now. So the first secret, get ready. Aha, even though we have a very vast toolbox, as Justin just mentioned, there's no denying that the bread and butter of chiropractic care, we already mentioned it, is SMT, or spinal manipulative therapy. And this is what we are best known for. And one reason is the sheer amount of positive research on spinal manipulative therapy for many conditions, but the top 3 proven in the research with like the best results in the research are neck pain, lower back pain, and headache. So yeah, lots of research. That's secret 1.
Really?
Yeah, and secret 2, chiropractic care is extremely safe. So yes, there are contraindications, of course, to certain aspects of chiropractic care, but that's why we are doctors of chiropractic. So just like a surgeon will tell you whether you are a good surgical candidate based on factors such as your age, your condition, any number of other factors, we know better than any other professional with our training and our understanding of our own work who to perform what therapy on, who will respond best to what, and what person can safely receive what type of treatment. We also know how to perform the treatments safely and how to modify the techniques to become safe for you. If we are talking about spinal manipulative therapy in particular, that's adjustments. Well, spinal manipulation is actually a controlled act, which means that legally only chiropractors and certain physiotherapists with extra training can legally perform them. So this law exists for a reason. It is to keep you, as patients and the public, safe. So chiropractors are especially trained to screen for contraindications to spinal adjustments, things like osteoporosis or low bone density, and certain inflammatory arthritides such as rheumatoid arthritis, and hypermobility issues like Ehlers-Danlos. And then if they aren't a candidate for that particular chiropractic tool, the adjustment, we would just then use a different tool in our tool belt to treat those individuals. So the last secret, chiropractic is not the be all end all. That means that, while chiropractors are pretty awesome at what we do and we get pretty fantastic results, very rarely is chiropractic alone the answer for any injury. At Choice, we recognize this, and so a lot of the time we complement chiropractic care with other forms of treatment. It is actually very common for us to refer to a colleague from another discipline within our team, sometimes outside of our team, to help us with your case. For example, if you display a weakness or abnormal muscle function, we'll refer you to one of our talented physiotherapists for exercise, strengthening, and rehab. We may co-manage a soft tissue injury, for example, with a massage therapist. And very often we look to the underlying nutritional or hormonal factors or just general lifestyle factors and refer on to our naturopathic doctor. So this multimodal approach to what is often a multifactorial injury, because most musculoskeletal injuries are very multifactorial, it's basically in effect what creates the fastest most complete results. In effect, this is the choice difference. All right, so now you've heard us talk enough about this, and we are now going to stop sharing my screen so that you can get a real good close-up and a good view of the treatment. So Justin is going to treat me.
Sounds good.
So I'll give you, we'll just forward, just do a fast forward history. Over the years, I've had mild recurrent neck pain and headaches. So that, I guess, would be my complaint. Like many people, I sometimes get a little bit stiff and tight in the neck.
Okay.
So I'm feeling that way today. I think I just slept a little, maybe too heavily. My workouts were a little bit heavy on the upper body. So I just thought maybe you could check my neck out.
Okay, definitely. We can look at that for you for sure. So for the sake of time, I'm going to do a little shortened physical exam for you guys today. So it's not going to be quite as long or as extensive as it would be with a full initial appointment. So Erin, I'm just going to have you taking a seat on the table for me, please. And what I'm going to do here is I'm going to check your range of motion, okay? So I just want to see how your neck is moving. So I'm going to get you to look to the right for me, please. Do you have any pain with that?
Just a little on this side.
A little bit on that right side, okay, and then look to the left for me. You feeling any pain there?
No.
Nothing, okay, come back to neutral, look up to the ceiling for me, and how's that?
Fine.
Okay, and then put your chin to your chest for me. You feeling any pain with that?
That's fine too.
Okay, come back to neutral. Now put your right ear to your right shoulder like this. Any pain there?
Not really, just a stretch on this side.
Okay, and then go to the other side for me. And how's that?
More of a stretch.
More of a stretch, okay. So based on the range of motion assessment of Erin, it seems like she could have some tight muscles in her shoulders here and in her neck. So I'm just going to be back here. I'm going to be feeling Erin's shoulders just to see, and I can actually see here on her right trapezius muscle or trap, she's got a lot of tightness here. And that's probably what's contributing to her feeling like she's a little bit tight when she goes to this side and a little bit of pain when she comes to this side. So what I'm going to do to start is I'm just going to do some of the active release technique that we talked about in order to help loosen up these muscles here.
I should have worn my hair up. Sorry.
Perfect, thank you. All right, Erin, so what I need you to do here is I need you to put your right ear to your right shoulder, and then I need you to go all the way to the other side for me, just as I apply this pressure, and you should feel like a light pressure there, so it shouldn't be too painful. Is that okay pressure-wise for you?
Yeah, feels
all right.
Good.
Come back to the right side. Good, now go all the way to the other side. Awesome, good. I can feel that muscle releasing, that's great. Go one more time for me. Good. Awesome, great. Good, feeling a little bit better there. So what I'm going to get you to do next, Erin, is lay down on your back for me, please. All right, so I'm just going to be checking the joints in Erin's neck here just to see how they're moving. All right, so I'm feeling in here the vertebrae in her spine, right and the left-hand side, and I can feel here that on this right-hand side, when I try to move her head to the left, it's not moving quite as well as it should be. So we're not getting as much movement in there. So what I want to do for you today, Erin, is I just want to do a spinal manipulation to the cervical spine. Is that okay?
Yes.
All right, perfect. So I just need you to relax your neck for me. Good. All right, take a deep breath in for me. Breathe all the way out. Good. Awesome. Got a nice release there. So now I'm feeling there, and I can feel that joint moving a lot better. Okay, Erin, you can hop up. Okay, now what I need you to do is look over your right shoulder for me. And how you feeling there? You still feeling pain?
No.
Feel a little bit better?
Okay.
Good. Try to put your left ear to your left shoulder. Good. And now go to the other side for me. You still feeling a pulling there?
Like none.
Feels much better. Awesome. That's great. So it seems like the treatment was a success.
Yeah, it was great.
Good. I'm glad to hear you're feeling better.
Thanks, Justin.
You're welcome.
So, I mean, that was just a brief demo. I should note that most of our treatments, they're at least 15.
Yeah.
Majority, I would say, run more to around 30 minutes at choice. So, you know, this was just like a mini kind of demo for the sake of this webinar. So now I'm going to go back to sharing my screen, and we'll get back into the presentation. Perfect. And I'm going to have to go down here again. Perfect. So yeah, who has this work for? So besides me, we've actually helped a lot of people over the years. In fact, millions of people worldwide see a chiropractor each year. So yes, chiropractic has worked for millions of people, and certainly chiropractic, our department here at Choice has helped probably tens of thousands of community members over our 11 plus years in operation. But we do have a couple of individuals in the practice who wanted to share with you their story. In this case, this was a patient who was super hesitant to go to a chiropractor. She says, I was nervous to go to a chiropractor for my chronic shoulder. And I will tell you, to say nervous is probably a huge understatement. For my chronic shoulder and neck pain, my Choice chiropractor spent time to listen and worked with me on a plan that managed my pain through using multiple techniques, as I mentioned, right? Like acupuncture, exercise, and hands-on treatment that worked for me. And that's Nora, a 43-year-old patient. And then almost the other end of the age spectrum, a 76-year-old patient here is discussing virtual care, which we actually had to implement through the pandemic. So, and we still do offer virtual telehealth for chiropractic and physiotherapy if needed. So this patient said, I had been suffering extreme burning pain in my buttock and down both sides of my leg for 5 days and nights, disabling me and keeping me from sleep. Through virtual telehealth, my chiropractor at Choice diagnosed the problem, taught me some exercise strategies that she felt I needed, and within a day I felt better and I'm sleeping and putting in a normal day's activities pain-free. So thank you, Choice Health Center, for answering my plea during this difficult time of isolation. So that's nice to read as well. Yes. So basically, we want to help you too. So we certainly want that for you, those experiences of Nora and Bev, and we want you to know that we're here for you. And if you're not certain what it is that you need, whether that's laser therapy, chiropractic, massage, physio, acu, or some kind of a combination of some of these things, that is absolutely okay. The Choice difference is that we do know and we will not lead you astray. So we want your results to come in as downstream as possible, just like this waterfall. Yes, so we hope that you have you found the webinar time well spent and you didn't just hang around for this prize at the end, but we do have that special offer for you. And what that is if you were watching this webinar live with us today, if you schedule an initial consultation with us, you will receive 20% off your next product purchase at Choice. So this is going to be valid for any product that we carry, except for certain supplements that require naturopathic prescription. And we will, so that basically leaves pillows and braces, collagen, good fat, shakes and bars. Everything else is pretty much fair game for this awesome little prize. So thank you guys so much for watching. And just in closing, I just want you, Justin and I want you to remember that you always have choices when it comes to your health.
Absolutely.
And we are here to help guide you in that. And if you are interested in booking a consultation with Justin or me or anyone else on the chiropractic team or any one of our other healthcare practitioners, you can do so by calling us at this number. We can actually get you to book online completely on your own. You can go on and see our schedules. You can actually email us directly at Dart or Hallie@choicehealthcenter.com. So yeah, thank you everyone for watching. And I am just going to, again, stop sharing my screen. And I'm going to see if we have anybody who has any questions. So if you have any questions, I see that we have no, we don't. Any questions, you can write them in the chat. So I don't see any. Oh, I have a mortgage payment. I'm not sharing my screen anymore. So we're we're going to stick around here. We actually did great for time. I see it's 8 o'clock. But yeah, we're going to stay on for a couple more minutes. And if anyone has any questions, feel free to ask.
Yeah.
Oh, is this a question? Saba, do you need a prescription? Great question, common question, and it's a perfect opportunity to explain what primary access actually means. So legally, you do not need a prescription. You can come to see a chiropractor without a referral from a medical doctor. 9 times out of 10, insurance does not require a prescription. So a lot of people will have extended healthcare benefits, and that will cover chiropractic care. And as I say, 9 times out of 10, the insurance company doesn't require that either. However, there are just like these odd plans. I would actually say 9.5 times out of 10. Certain extended healthcare plans do require the prescription, but that would just be for your coverage.
Yeah, and even if you just happen to be driving by one of our clinics and you want to stop in because you noticed something that day and someone's available, we could actually take you that day without any other thing that's done. So we're available to help you right away if need be.
That's right. We're even open on Saturdays at our
we
Halifax
are.
location with Dr. Justin
That's
on.
right.
Looks like we have a couple other ones. Okay, I'm going to skip this one here, but I'm going to go to this next one while we're just kind of talking a little bit about coverage and keep on topic there. Does WCB cover chiropractic? Yes, it does actually. So if you are injured at work, you can go directly to our clinic. Our Dartmouth location is WCB accredited, and yeah, you can just call right in. You don't need again, no referral is necessary, and it most certainly covers chiropractic care. Mm-hmm. And the other question we had here from Bridget, great presentation, thank you. And what is the Kin Stretch program you offer? Great question as well. I'm actually like the only certified Kin Stretch instructor east of Montreal, north of Boston type of thing. So I'm really excited to be the first Kin Stretch instructor in this region. And I'm looking to like basically help people move better. So this is a very neurology and kind of a functional neurology based mobility program. So it's an exercise class. You don't need an assessment, because as I watch you move, I'm assessing how you move. It's a very safe way to not only maintain mobility, but to improve mobility. And it's appropriate for anyone from like a high level elite athlete, which is actually where it got its start with MLB, NBA, high level UFC fighters. Now it's with I could go on golf. You can Google it and see the elite athletes that use it. But I can also, and a lot of my classes do kind of, it's more for the recreational athlete or even the older individual and a senior even who is just looking to maintain their mobility in a fun class setting, very scientific based. Yeah, so hopefully that sort of answers the question about Kin Stretch.
Yeah, it sounds great. Maybe I'll have to give it a shot sometime.
You so should.
Yeah, I'd love
check
to stop
it out.
in.
Yes.
Yeah, that'd be great.
Yeah, absolutely. Awesome. Well, I think that's probably all the time we will have for questions tonight. But listen, any other questions, just send us an email. You can check out our website, get our contact information from there. And if there's any hesitancies at all, just give us a call and we can just talk with you and figure out if chiropractic care is right for you.
Definitely. We're happy to help you guys out whenever you need. So don't be hesitant to reach out to us at all.
Yeah. And thank you guys for joining us. We appreciate it, and we will hopefully hear from you soon. Take care.
Bye, everyone.
Bye-bye.